Nurse Awesome. I was having a chat with some first semester nursing students the other day, and one of them said, Melissa, I really don't feel like I'm learning anything in first semester. I'm certainly not learning how to be a nurse, and I don't even know what it is that I'm supposed to be doing all day, every single day. What exactly is the role of a nurse in the hospital? So, that's a huge question. You could follow 5 different nurses around every single day, and they would be doing a lot of different things depending on the area they were at in the hospital. The one thing you can count on for sure that they're going to be doing for their patients is really paying attention to every single thing that happens for their patient. The real role of the nurse in the hospital situation is to kind of be the hub of the wheel, the very center of everything that happens for the patient. So you can think of all of these ancillary activities going on, like speech therapy or physical therapy, maybe pharmacology or medicine, what the doctor is actually doing, nutrition therapy, all of that all kind of goes around, and here's the nurse in the very middle. You are the communicator, you are the eyes and ears of the doctor, and you're the person that everyone depends on to know exactly what's going on with that patient at all times. And what better person than you? I mean, the nurse is the person in the room with the patient most of the time. The physical therapist, they're going to read the chart. Respiratory, they're going to read the chart. They'll come by and see your patients occasionally, but they don't know your patients the way that you do. You have created this incredible sacred space with your patient. They depend on you to advocate for them, to provide for their needs while they can't, to protect them, to make sure that no bad stuff jumps off while they're with you, while they're in this really vulnerable place, They literally say to you, here, I'm going to trust you with my life for this minute in time. Wow, that's pretty awesome to be able to do that every single day. So I hope that you guys can think of yourself as that hub of the wheel, and that all of those spokes, including what the doctor does, kind of come off of that. The doctor depends on you so much. There's no way that he's going to be at the bedside as much as you. Talk to the doctor. Tell him what's going on. Let him know. Don't ever think that because you're a first or second semester nursing student that you don't know your patient. If something looks wrong, say something to someone, because you know your patient, and your patient is counting on you to talk about what's going on with their care. So before I get way too emotional about how important you are as a nurse, even though in first semester it doesn't always feel that way, I'm going to sign off. I'm going to start to make some videos about some kind of complicated concepts in nursing school. First one's going to be about diabetes, mellitus versus insipidus, and then we're going to wrap about third spacing. So send me an email that tells me what you want me to talk about. I'm going to break stuff down into its real basic parts, draw some pictures, and hope get your understanding on those things. So I want you guys to keep being Nurse Awesome, and remember, you're the hub of that wheel, baby. Peace. Y'all have a great day.